Welcome to The Dental Brief, the podcast that delivers actionable insights and expert strategies to help dental professionals like you grow, lead, and succeed. I'm your host, Patrick Shavasty, the president of Omni Premier Marketing. Every week at The Dental Brief, we bring you real conversations from expert speakers that offer expert advice and quick tips that make a real difference in practices nationwide. Whether you're a general dentist or run a multi-location practice, we've got you covered with content that's designed to help you attract more patients, to streamline your operations, reduce headaches in managing your practice, and increase your profitability. If you're ready to elevate your practice, be sure to subscribe, hit the notifications bell, and let's dive into today's episode of The Dental Brief. Hello, everyone. Welcome to another episode of The Dental Brief. I'm excited for today's guest to be here with us. I'm going to do the introduction in a second, but I'm going to say he's at a conference right now at the Gaylord Convention Center, just east of downtown Denver by the airport. Lincoln Harris, say hello to everyone.
Hey, thank you so much for having me. It's a pleasure to be on your podcast, and this is my most Colorado resorty background ever. So,
yeah, it's great. It fits. I know you're a real busy guy, so again, I appreciate you taking the time to meet with us. Give us a little backstory. Tell us about RipeGlobal for anyone listening who hasn't heard of you.
Yeah, I mean, it's a dumb name. It actually started with a Facebook group called Restorative Implant Practice Excellence. And then people started asking me how to learn things. So I started running regular hands-on courses. In 2000, we had 4 big innovations along the way. The first one was how to make hands-on courses shorter. So we put all of our didactics online so that when you turned up for a hands-on course, you actually did a hands-on course. And then we saw people getting complications. So we thought, how do we make training better? And we looked at the aviation model, where you do, when you're flying a plane and trying to learn to land, you just practice one landing after another. So massive repetitions was our second big innovation. And then COVID came and I was sitting there feeling sad, and I thought I can either sit here and suck my thumb and cry, or I can solve this problem. So that's when we asked, if no one could ever travel again, how do you teach a procedure? So we developed simulation training. We manufacture training mannequins. We ship them to 35 countries. We built all the software to run it. And right now we are the leading associate dentist productivity partner, probably in the world. So if you employ dentists and they're not as productive as you would like, then you come to us.
That's fantastic. I mean, that's absolutely awesome. I love it. You know, where you started, kind of how fast you've grown, how quickly you've gotten to where you're at. I'm sure you've got a lot of new awesome things coming online. I know one of the things that you've got now is some AI training. I highly recommend any dentist get into it. I know a lot of people are kind of shunning it and saying, oh, it's never going to come into dentistry. We're not going to need it. It's already in dentistry, and it's going to become a big part of dentistry. It's going to become a big part of everything, of course, if it's not legislated away. So tell me, in your travels, I know you're at a convention, like I said, right now, you talk to a lot of dentists. You talk to a lot of people who support dentists. What are some of the biggest challenges that you see that dentists are facing right now today?
The biggest challenge that dentists have right now, and one they've had for a long time, is that a dental degree is 4 years long now, and 185 years ago, when dental degrees were first invented, they were 3 years long. So it's got 1 year longer, but dentistry's got significantly more complex in the last 185 years. And basically, when you graduate now, you can do about 6% of what an experienced general dentist is required to do. I went and added up all the procedures that I can do, and I looked how many of them I could do when I graduated. It's 6%. So 94% of what you need to learn to be a highly productive, highly experienced, and highly effective general dentist, you have to go and learn on your own by attending a random assortment of weekend courses. So that relates to people saying their number one thing when they graduate is they want mentoring. So that's the problem that I see all around the world. You know 6% of dentistry when you graduate.
Yeah, 6%. It's crazy when you think about it that way. I think a lot of people know that, but they don't actually think about it, right? It's not something that's in their conscious mind at all. So constant education is obviously important. There's procedures that are out this year that didn't even exist last year, right? So it's ever changing. You mentioned mentorship a little bit. I think a lot of people are worried about finding a mentor or working with a mentor, or maybe even think that they don't need a mentor. What do you say to those people? How do you get over that?
I mean, I think people are right to be worried, because everyone who advertises a job in dentistry says that they have mentorship. What that sometimes means is a text message after work from the boss, can mean all sorts of things. And I think a lot of people have good intentions, but if you're a really high producing owner doctor, to take time off to mentor someone can be difficult from a financial point of view. And then it can also be very difficult if you don't have skills in mentorship. So training a dentist or teaching a dentist how to do things is not the same as being able to do them. Just
Sure.
because you can play golf doesn't mean you can teach golf. And so that's one problem. And then the second problem is that people are looking for mentorship, and the entire world of dentistry is getting gobbled up by every type of investment firm you can imagine. We've got private equity, we've got family offices, we've got high net worths, we've got dentists who just wanted one more practice and it got out of hand. And so you have these two simultaneous things. If they're a small office, the owner doctor is busy and highly producing, so it's difficult for them to take the time. And if they're a massive DSO, there are incredible challenges with scaling the mentorship of doctors to hundreds or thousands of offices. So there is actually a big problem with mentorship. Thankfully, it's one that we can solve. So if you are a young dentist and you're not going into a GPR, then you can come into one of our 1 or 2 year programs, and we will take you straight from dental school to being able to do a full mouth rehabilitation in 2 years at about a quarter of the cost of any of the old-fashioned options like going to Scottsdale or Seattle. So now, if you like to sit on a yacht and get pictures of yourself, that's great. But you know, I don't have yachts. There's no yacht photos as part of this program.
Yeah. So, you know, typically we're very cautious about allowing people to promote necessarily their products. We like people to talk about solutions and problems and that sort of thing. But with what you're doing, it is very different than what else is out there, very different than what I'm seeing. You really do seem to be a complete solution for dentists in this area. So pitch away. Tell us about RipeGlobal. Tell us about who is working with you now, who's ideal to work with you, and who will benefit the most.
Yeah, we have two completely separate customers. Our first customer, which is where we started, was the young dentist who wanted to have continuous mentoring. When you go fly somewhere for a couple of days, the training and education is designed around the fact that you are there for 2 days. So we're going to force feed you, like trying to, like force feed a duck to get liver pate. You're going to force feed you all of this learning and education in 2 days because you're here. People don't actually learn like that. Like, people learn best when they are repetitively trained over time.
Sure.
There's a lot of studies around this. We know that when you force feed someone education and training, they forget 85% of it almost immediately. We wanted to change that, so we deliver our lectures and didactic areas online. They come in a big list of digestible things that you can work through, but we have our own community, which is in our platform, so you can get continuous and almost 24/7 feedback or help, because we teach in so many countries. There's always someone online. These are not Facebook groups, so you're not going to get bullied or trolled or anything like that, because it's our own private forum. You can reach out to your teachers at any time. So you have that continuous mentoring. You can look up the theoretical parts at any time. And then for hands-on, we want it to be a simulation. So we want it to be as close to actual practice as possible. Now, something that is not close to practice is going to a hotel and picking up a typodont and then sticking the handpiece through the back of the neck because it's more convenient, because there's no neck there, and using a set of burrs that you will never use again because they're the sponsors, and you have no water spray because it floods the hotel. And so the way that we get trained is so different to treating a patient that 95% of the battle is, how do you implement? You go home and then you have to work out how to implement. And the implementation is often 90% more difficult than just learning the procedure. And you've also never done enough repetitions. Typically, most hands-on courses, you are lucky to do one repetition, and you do it really slowly between a buffet lunch and afternoon tea.
Sure.
So we don't train like that. We want it to be. So if we want to teach you crown preps, we ship a mannequin, you stick it on your chair, you sit in the normal seat that you normally sit in, you have your handpiece that you normally prep with, your normal burrs, and we don't stop for morning tea because no one has that. and we don't stop for an hour lunch because no one does that either. And we'll do 17 preps in a day. And at the end of the day, it's like muscle memory. And so with us, we want to train someone so well that when the patient is gagging and they're telling you that they hate you and the anesthetic's not working and they're jumping and you're stressed, you can still do the procedure. So that's what we mean when we say simulation. We want it to actually be real. And then when you do that, the difficulty to implement is much lower. So from Saturday when you're training in your chair to Monday when you're treating a patient in the same chair is massively easier. So that's why we're different. It was not easy to build, so that's why no one's copying us yet. But they will soon, I can tell you.
Sure. Yeah, of course. Anything that's brilliant, somebody's going to want to try to copy at some point. I see that one thing is a little bit of an accent. So I think a lot of people might think that you're just limited to one part of the year. I know you mentioned that you live here in Colorado, as do I, but you're literally all over the world, right? And on your website, obviously Australia is there, the UK is there, US is there. I saw Singapore there. I think I saw Germany. You're literally all over the planet, aren't you?
Yeah, so we train dentists currently in 35 countries, but because American dentists, despite everything they say, are the richest single group of dentistry in the world, they account for 40% of the entire global output for continuing education. So that's why I live here, besides the fact that I actually just really like the United States. It's a great country. I have a lot of fun here. So, yeah.
One thing I saw on your website, I want people to check this out. I'll say it's for younger dentists to check out. 2025 entries are now closed, but I'm sure at some point you're going to have your 2026 entries for Dentist of the Year. Is that correct?
Yeah, so we wanted to recognize young dentists who really go out and try hard to progress. And one of the amazing things about the modern era is that young dentists can achieve things at a younger age and to a greater extent than ever before. And when I was a young dentist, there was all these old grumpy dentists who were saying, well, you need to walk before you can run. And what they meant was, don't do anything better than me because I'll feel insecure. We don't believe in that. We just want to train you to run straight from dental school. So the Dentist of the Year competition is pretty cool. You win training. There's like about $40,000 worth of prizes. And we make you famous. So if you win it, you'll be like a world famous dentist in about 2 years. So for next year, if you're an ambitious young dentist and you want to get trained like hell when you graduate and become famous and get on the rocket ship of your career, you should definitely apply for this next year.
Awesome. I want to encourage everyone to check out the website. Great amount of information on there. Great resources section. RipeGlobal.com. Check it out. It's a must. Lincoln, thanks so much for coming on, sharing with us today. I appreciate your time and appreciate you helping dentists grow.
Hey, thanks for having me. And thanks for all you do to help share new stories and new ideas around the world. Love it.
Thanks for listening to this episode of The Dental Brief. If you found it helpful, give it a thumbs up, subscribe to the channel, and share it with a colleague who could benefit. We're here to help dental professionals like you stay ahead of the curve, one brief episode at a time. You can find more episodes and resources at thedentalbrief.com. You can also join the Growth-Minded Dentist community on Facebook. Links are in the description. Until next time, keep learning, keep growing, and thanks for being part of the Dental Brief community.